Hello, my dear doctors. Hope you are fine. Now I'm going to start 4 subjects, that is surgery, anatomy, radiology, orthopedics. Hope you are fine. Try to start these questions. Give your attention. Our first question is identify the structure marked by the arrow. This arrow marked by here. Okay. What is it? So this is there are 4 options: right third anterior rib, option B right third posterior rib, option C right fourth anterior rib, option D right fourth posterior rib. So this is left, this is right. Okay, first of all we should make it confirm left and right side of the x-ray. Okay, so this rib, okay, this rib, what is the position of this rib? Okay, so try to pay your attention to understand a little bit here. Okay, then we can come to an answer. Okay, so this is a clavicle. Okay, this is clavicle part. This is aortic. Here is the aortic knob. Pulmonary artery is here. Is a hilum. Left atrium, right atrium. Right atrium is here, then right ventricle is here. Left atrium is here, then left ventricle is here. Okay, this is this part, costophrenic angle. This part is costophrenic angle. Okay, this part is costophrenic angle. This part is costophrenic angle and cardiophrenic angle. Here is this part is cardiophrenic angle. Okay, this is the posterior rib, posterior side of the ribs, and the counting is 1, 2, 3. That is 4. Here is a 4. Okay, 4, 3, and this is clavicle. Here, come to our points. First of all, I will also explain this picture. Okay, this is the first. Okay, this is the first rib. After that, this is the first rib, then second rib, third rib. Here is the fourth rib, fifth rib. Okay, mid-clavicular line. This is the mid-clavicular line. Okay, why it is mid-clavicular line? Because this line is in the middle of the clavicle. Okay, this is a clavicle supraesternal notch. This is supraesternal on the sternum. Okay, this is this part here, sternal ridge, also known as angle of Lewis. After that, this position. Okay, and here is this position. Here is sternal angle. Okay, here is supraesternal notch. Second intercostal space. This one is supra. Okay, external, supraesternal. This is supraesternal. This is sternal of Lewis, sternal ridge, angle of Lewis. This is second intercostal space, and this part. Okay, here. Fourth intercostal space. Okay, fourth intercostal. This is a mid-clavicular line. Okay, this is mid-clavicular line. Okay, so according to all this information in this question, option this comes. Okay, this position, this marking comes near right fourth posterior rib. Right fourth posterior rib. Come to the question second, which is very important and mostly asked in most of the exam. First of all, you see this image. Okay, It's given in the picture. I'm not giving by myself. Second question, a traffic police officer who met with the road traffic accidents is an unconscious state. Blood pressure is classic benchmark. Blood pressure is normal, 120 by 80 mmHg, and an NCCT image is shown below. That is NCCT image is shown below. What is the likely diagnosis? Okay, so likely diagnosis. First of all, I will tell you a few important points and then we'll come to the question. This part is epidural hematoma. Epidural hematoma, and this part is subdural hematoma. Okay. This is venous blood. This is arterial blood. It's red or it's bluish in color. This is a skull fracture, maybe with a strong hammer or something, or accidental fracture. This is here due to this fracture, middle meningeal nerve artery is damaged. This is dura mater. This is dura. This is venous blood. Okay, come to this picture. Come to this picture. Okay, come to this picture. This is epidural. Okay, this is epidural and this is subdural. Okay, this part in NCCT, this part is convex. This part is convex. Convex. This part is convex, or we can say lemon sept, or this part is concave. You know, this part is concave or crescent shape. Concave or crescent shape. Concave or crescent shape. This part is convex or lemon sept. Okay. So according to this explanation, come to our question. Okay. There. Yeah. So according to our explanation, according to this part is convex or lemon sept Okay, so this is generally epidural. Okay, this is epidural. So according to this, in this question, second question, a traffic police officer who met with road traffic accident is in an unconscious state. Blood pressure is the classic benchmark of 120 by 80 mmHg, and an NCCT image is shown below. This one. What is the likely diagnosis? So according to all this explanation, answer D, EDH. Okay, EDH is the answer. Okay. Come to the question number 3. Question number 3. Identify the marked structure on the given CT scan. So first of all, you should know this is CT or X-ray or MRI. Okay, so this is given in the CT, and you have to mark the given arrow, this arrow here. Okay, so what is this? This is option A, frontal sinus, option B, maxillary sinus, option C, ethmoidal sinus, option D, mastoid. Okay, so this is option B, maxillary sinus. Okay, option B, maxillary sinus. Come to the explanation, little bit explanation about all this. Okay, this is generally frontal sinus. Why? Because the sinus means nothing, is cavity. This is in the front, so frontal sinus. This is in the ethmoid area, so ethmoidal sinus. This is in the maxillary area. Okay, so this is called maxillary sinus. On this part is in the sphenoid area, so sphenoidal sinus. This is maxillary sinus. This is frontal sinus. Okay, frontal sinus. This is ethmoidal sinus. Come to this picture, okay? Come to this picture. I will show you in a clear, yeah. Come to this picture. These are the sinuses, okay? Sinus or sinusitis. Healthy sinuses, this is the healthy sinuses. These are sinusitis. I told you in this part is the frontal sinus. This is in the front, so frontal sinus. Here in the frontal sinus, there is an inflammation. That is sinusitis. That is why you tell inflammation. This part, ethmoid sinus. This is in the maxillary area, maxillary sinus, and here in this there is a obstructed sinus opening. Sinus opening is obstructed and sinus infection. That is why there is a sinus infection. Okay. So according to sinus, we have few information now. Already I answered the question third. Come to the question fourth. Okay. Come to the question fourth. Identify what marked structure in the given image. Okay. The marked structure, already there is a marking, there is a marking, okay, already there is a marking. So what is this? The marked structure. This is the first part of duodenum. This is first part of duodenum. Okay, come to the question number 5. Question number 5. A cancer patient undergoing radiotherapy, given a dose 1.822 gray, okay, once daily for 5 days per week for a duration of 6 to 8 weeks. What is this type of radiation therapy called? Okay. So, option A, hyperfractionated radiotherapy. Option B, hypofractionated radiotherapy. Option C, accelerated radiotherapy, or option D, regular fractionated radiotherapy or conventional therapy. Okay, why? First of all, I will let you know 1.822 GY. Okay, GY. This is called GY stand for gray. GY stand for gray, and the standard unit of absorbed radiation dose in the International System of Units. It measures the amount of ionizing radiation energy absorbed by tissue, defined as 1 joule of energy per kilogram of matter. Role in radiotherapy. In radiotherapy, doses like 1.822 gray are typical per fraction to target tumors while sparing healthy tissue, with total treatments often ranging from 30 to 80 gray, okay, depending on the cancer type, which type of cancer is it. This precise measurement helps doctors plan effective therapy and monitor side effects. One gray, 1 gray is equal to 100 centigrade, okay, 100 centigrade. That is called centigrade, CGY, or RAD, okay, RAD. Come to the another question, question 6. Question 6. Question 6, okay. Question 6. What is investigation of choice? Investigation of choice for a neuroendocrine tumor, that is NET. NET is neuroendocrine tumor. PET CT, MRI, USG, CT. Read again. What is the investigation of choice for neuroendocrine tumor? Investigation of choice is PET-CT. Okay. Neuroendocrine tumor are rare neoplasms arising from neuroendocrine cells that possesses both endocrine hormone secreting and neural features. Okay. Modality. Okay. Come to this. Modality. Very good. Very informative. We will have some knowledge from this information. Okay. Modality. Modality strength. First, this is modality, strength, and limitation versus PET-CT. Highest sensitivity, highest specificity, functional and anatomic first line for staging. Limitation, higher cost. Okay, what is the limitation? Higher cost or limited availability of what? Of PET-CT. PET-CT, highest sensitivity and specificity. Okay, functional and anatomic first line for staging. Higher cost, limited availability. It's not available everywhere, especially in the village area. B, excellent is excellent for soft tissue contrast. No radiation. Excellent for soft tissue. Always remember, MRI is only for soft tissue. MRI for soft tissue. MRI for soft tissue. Okay. What is the limitation of MRI? Misses small tissue, extrahepatic lesions, less sensitive for neuroendocrine tumor. NET help for neuroendocrine. Okay. Neuroendocrine tumors. Come for the next. C. Non-invasive. Which is non-invasive? Good for pancreas and liver. Non-invasive. That is USG. USG is non-invasive. Good for pancreas and liver. Operator dependent. Limitation depend on the operator. If the operator is very good, he will perform very well. If not, then maybe the result will vary. It depends upon the operator. Who are for deep or staging. Okay, so USG is not good for staging. Fourth, CT. Okay, widely available. CT is widely available, especially fast staging. Anatomic only, lower sensitivity, but it's 60 to 85% is okay. Okay. Okay, come to this point. Very important, informative point. PET-CT. PET-CT. What is PET-CT? Combined positron emission tomography, that is PET, with computed tomography, that is CT. For hybrid imaging, it uses radioactive tracers like 68Ga dotate for neuroendocrine tumors injected into the body. PET detects metabolic activity. While CT provides detailed anatomy. Very important point. PET detects metabolic activity while CT provide detailed anatomy. Okay. So come for the question number 7. Okay. Question number 7. Identify the condition in the following radiological image. I hope you people know this image. Okay. That's nothing but horse kidney. Very easy. You people know it. No need to explain too much detail. A little bit. Try to understand this figure. Okay. Horseshoe kidney, horseshoe shaped. This is the right side. Okay. This is the left side. IVC. Okay. Aorta. Isthmus. Okay. So this is all about this figure. Come to the question number 8. Question number 8. The structure given in the image, key part of the small intestine in the gastrointestinal system. Please identify the structure. This structure is nothing but jejunum. Okay, this structure is nothing but jejunum. Come to the question number 9. Okay, question number 9. Which chest X-ray sign is classically associated with left atrial enlargement? Left atrial enlargement. Okay. Option A, double right heart border. Option B, widened mediastinum. Option C, rib notching. Option D, curly B lines. Okay. First of all, come to this point. Okay. What is double density sign? First point indicates left atrial enlargement. Double density sign, left atrial enlargement. Okay. Left atrial enlargement. Okay. You can see here left atrial enlargement occurs when right side of the left atrium pushes when the right side of the left atrium pushes into adjacent lung, splaying of the carina, superior displacement of the left main stem bronchus from frontal view, posterior displacement of the left main stem bronchus on the lateral view, posterior displacement of the esophagus on barium study. Okay, come to the question now. Which chest X-ray sign is classically associated with left atrial enlargement? It is left atrial enlargement. A, double right heart border. Question number 10. Question number 10. Very easy. No need to explain too much detail. Identify the structure shown in the arrow. This area is very important, very easy question. Therion. Okay. Question number 11. Come to the question number 11. Okay. Question number 11. Identify the structure shown in the image indicated by the arrow. This part. Arrow. Very easy. I will let you know a little bit. 11. Yeah. 11. Okay. For Therion, I will make you clear. This part is Therion, which is given in the question. This is lambda suture. This is glabella. Okay. Nation. Okay. Asterion. This is also lambda. This is the option. This is inion. Okay. Come to this picture. This picture is thalamus. This is thalamus. Not here is thalamus. That is the marking. Thalamus. Splenium of the corpus callosum. This part is mesencephalon. This part is mesencephalon. This part is the fourth ventricle, which is given in our question. Fourth ventricle. This is pons. Ethmoid air cells. Interior nasal concha. Hypophysis. Genu of the corpus callosum. This is genu of the corpus callosum. This is splenium of the corpus callosum. Okay. Come to the very clear picture. This picture very clear, given in our question. This part is the fourth. This part is the fourth ventricle. This part is the aqueduct of the Sylvius. This part is the midline of foramina. This part is the third ventricle. Maybe next time they will ask the third ventricle, not the fourth ventricle. Fourth ventricle is a very common question. So maybe next time they will ask the third ventricle, or They can also ask the lateral ventricle. Not if not third ventricle, not third ventricle, not fourth ventricle, then lateral ventricle. Okay, then they will ask lateral ventricle. Okay, so come to our question. Yes, this is our question. Our question was here. So identify the structure shown in the image indicated by this is not for thalamus. Don't make mistake here. Okay, otherwise you will make mistake. Option A, you will make mistake. Cerebral aqueduct, cerebellum. No cerebellum. Cerebellum is in the back here. Okay. So this is fourth ventricle. This is fourth ventricle. Come to the question number 12. Okay. Question number 12. Which of the following passes through the Gans canal? Passes through the Gans canal. Question number 12. Radial nerve. B. Median nerve. C. Ulnar nerve. And D. Auxiliary nerve. Yes. Please tell me. Yes. Option B. No. Median nerve. You. Option A. Radial nerve. No. Not radial nerve. So, yes, you are right. Ulnar nerve. Come to the question number 13. Identify the procedure given in the picture. So, you know, in the modern technology, advanced technology, nowadays we are doing very advanced robotic surgery. Okay, robotic surgery. So this is robotic surgery. Okay, robotic surgery. One thing I will make you clear in question number 13, question number 12 for the radial nerve, median nerve, ulnar nerve, auxiliary nerve. You people know about this. Ulnar nerve passes through Gans canal. The Gans canal or ulnar tunnel at the wrist contains the ulnar nerve and ulnar artery as they enter the hand from the forearm. The ulnar nerve bifurcates into superficial and sensory and deep motor branches within the canal. Other option, why other option is not the radial? Not the radial because radial travels through the radial tunnel. Radial tunnel. It travels through the radial tunnel. Okay, where? Elbow. Okay. Median passes through the carpal tunnel. Medial passes through the carpal tunnel. Okay, and auxiliary passes through the where? It's located. Auxiliary located in the shoulder. That is in the quadrangular space. Okay. Okay, question number 13 finished. Okay. Come to the question number 14. Okay. Come to the question number 14. Question number 14. Okay. Which of the following is damaged in the Indian wicket keeper's thumb? Indian cricket player, whenever they play the cricket, especially the wicket keepers, which fractures generally happen? Okay, which fractures generally happen? This is ulnar collateral ligament. What? Ulnar collateral ligament in the wicket keeper. Ulnar collateral ligament. Okay, where? Ulnar collateral ligament. Okay, it's see, this is the median nerve. This is the tendons, median, ligament, carpal tunnel, cross section here, tendon, a sheath tendon, carpal tunnel, median nerve, ligament, and area of numbness and pain shaded. Okay. So in this ulnar collateral ligament. Question 14, ulnar collateral ligament. Come to the question 15. Come to the question number 15. Which of the following is not component of carpal tunnel? Which of the following is not component of carpal tunnel? Okay, that is option A given: median nerve, flexor digitorum profundus, flexor pollicis longus tendons, and ulnar nerve. So which of the following is not component of carpal tunnel? Not component of carpal tunnel. Okay, this is the carpal tunnel. Okay, this is the carpal tunnel. This is the carpal tunnel. Not component. Okay, tendon sheath, tendons and ligaments and cross section here. This carpal tunnel. See, tendons, median nerve, and ligament. Okay, come to the question 15. So 15, the answer will be ulnar nerve. This is not the component of carpal tunnel. Ulnar nerve. Okay, not the component of carpal tunnel. Come to the question number 16. 16. Identify the structure marked below. This structure in the lungs. You can tell me what is this. Okay, tell me this. What is this? Okay. So there are three questions in this one. Okay, identify the structure marked below. So here in question 16, this is option A, azygous vein. I don't think so. Hemiazygous vein, minor fissure of the right lung, major fissure of the left lung. So first of all, you should know this is the option C, minor fissure of the right lung. Minor fissure of the right lung. Okay, minor fissure of the right lung. So this is minor fissure of the right lung. Okay, and what is this? This is a right major fissure. Right major fissure. Yeah, this round one. This is mitral valve. Mitral valve replacement. Mitral valve replacement. Okay. Come to the next question. Question number 17. Which of the following is associated with a rheumatic heart disease? I have already explained in my previous video, McCollum patch. Okay, 17. McCollum patch, maybe you can see my previous video. What is McCollum plaques? Rheumatic heart disease describes a group of short-term, that is acute, and long-term chronic heart disorder that occurs as a result of acute rheumatic fever. Point second, damage to the heart valves is a common result of rheumatic fever. Point number 3, it is usually seen in the children who are 5 to 15 years old. Mural endocardial lesions can be seen as McCollum plaques in rheumatic heart disease. Point number 4, these plaques appear as a map-like area of thickened, roughened, wrinkled part of the endocardium in the left atrium. Okay, so this is McCollum plaques for rheumatic heart disease patient. Okay, come to the question number 18. Okay, question number 18. A patient underwent GI surgery. Okay, and the jejunum was resected. Which of the following drugs would be added to the treatment of this patient? Which of the following drugs would be added? Okay, liraglutide, option A, liraglutide, option B, tegoglutide, option C, exenatide, option D, semaglutide. Okay, so here the option answer is tegoglutide. Tegoglutide, option B. Tegoglutide. Tegoglutide, option B. Appropriate drug to add. Okay, why? Because Reason for teduglutide jejunum resection often leads to short bowel syndrome, that is short bowel syndrome (SBS), causing malabsorption of fluids and nutrients that require parenteral support. Point number 2, teduglutide, a GLP-2 analog, promotes intestinal adaptations by enhancing mucosa growth, improving nutrients absorption, and reducing need for parenteral nutrition. Point 3, clinical studies show it effectively treats SBS, that is short bowel syndrome, after resection, including jejunostomy cases. Why not other options? Like option A, liraglutide. Option A, liraglutide. Why not? Because why not option C, exenatide? Why not option D? Okay, so option A, option C, option D are GLP-1 receptor agonists used for diabetes or weight loss. Point number 2, these drugs slow gastric emptying but lack in intestinotrophic effect for SBS. That is SBS, that is short bowel syndrome. So this is all about 18. Come to the 19. What is the type of skin graft used in this image? This skin graft, okay? Thiers graft, option B, deeper split thickness, option C, thick split thickness skin, option D, myocutaneous flap. So first of all, I will tell you what is the answer. Maybe you should remember this because this is Thiers graft. It's okay, big and like something different. There are two types of mainly full thickness skin graft and partial thickness skin graft. What is the established better cosmetic results? Full thickness skin graft, better cosmetic results and decreased contraction. Partial thickness skin graft advantage, higher success rate, easy to harvest, faster revascularization. Okay. So what is Thiers? What is Thiers? Okay. What is Thiers graft? TH. Thiers. IERSCS. Thiers. What is Thiers grafts? Okay. Thiers grafts, also called as Thiers, are the thinnest split thickness skin grafts, typically 0.1 to 0.15. Typically, this is the thickness. Okay. thick. Thick. Okay. Thiers thick. Including only the epidermis and minimal dermis, they appear very thin, translucent and shiny, often and are often used for large wounds due to easy harvesting with a dermatome or razor. This matches classic depictions of ultra thin grafts in the medical images. So this is Thiers graft. Okay, come to the question number 19. This is Thiers. There, see, you can see from this picture. You can see here. Mainly the full thickness, and mainly the partial thickness. What is the disadvantage of full thickness skin graft? Higher risk of graft failure, longer healing time, limited donor site availability. Disadvantage of the partial, less desirable cosmetics outcomes and more likely to contract. Okay, so this is, come to the question number 20. Question number 20. Yeah. Very easy. During the surgery, general surgeons find this method to be quite helpful. Determine the surgical technique is depicted in the image. Surgical technique, see, they are cutting from here, dissected, surgery, and after that they joint here. Okay, that is called anastomosis. Okay, so option A, primary closure of perforation. Option B, resection and anastomosis. Option C, ileostomy. Option D, resection alone. No resection alone. See, first of all, they cut it from here, they cut it, resected, and again anastomosis. Okay, now see here, it's better now. See here, it's okay. Both the point they're joined here and see anastomosis. So option B, resected and anastomosis. Option B. Come to the question number 11. Very easy, very easy. You will 21. A bullet train driver underwent surgery for pilonidal sinus. Which type of flap is used in this surgical procedure? So they are asking about this flap. This flap. See this flap. Okay. This is called rotational flap. Okay. See, this is called rotational flap. Okay. So option A. Not transposition flap, not axial flap, not advancement flap. Okay. Come to question number 22. First of all, you see the image. A patient suffered from prick injury, just like a needle. Okay. Needle, prick injury, something pricking. Okay. On the palm. Where? On the palm. Shown in the image given below, given here. Which of the following is correct statement about this type of injury? It shows a frog-like appearance. No. It is more common on the dorsal surface of the hand. No. It requires incision and drainage. Just wait. It should be treated by removal of the cause. Yes, it should be. First of all, it should be treated because it's something pricked inside your palm. So first of all, you remove that needle or thorn or whatever, and then you give symptomatic treatment. Okay. Come to the next question. Very easy question. 23. Which of the following is most radiosensitive? Most radiosensitive. Which of the following is most radiosensitive? Most radiosensitive. Testis, bones, nerves, muscles. Testis, bones, nerves, muscles. Testis. Okay. Question 24. Sorry, it's not 25, it's 24. Paid based on which of the following? Paid based on which of the following? That is oxygen uptake, glucose metabolism, protein metabolism, and fat metabolism. So paid based on which of the following? Glucose metabolism. Okay. Come to the next question. That is called 26. Which of the following contrast is used in PET? Which contrast is used in PET? Option A, fluorodeoxyglucose. Option B, gadolinium. Option C, calcium. Option D, iohexol. So, which option? Option A, FDG. PET tracer basics. What is PET tracer basics? PET imaging relies on positron emitting radio tracers, not traditional contrast agents. FDG leveled with fluorine 18 is the standard tracer as it accumulates in the high glucose uptake tissues like tumors, enabling detection via positron emission. Okay. So this is option A. Come to the next question. That is question 27. Question 27. GA68 PSMA scan is used to diagnose which of the following conditions? Okay. A, lung cancer. B, prostate cancer. C, liver cancer. D, colon cancer. No. GA, that is GA68 PSMA. Here is P. So answer is prostate. Okay, so answer is prostate. 28. Come to the question number 28. Okay, this question. A 40-year-old female patient presents with complaint of abdominal pain. Further investigation shows elevated PTH is high levels and renal calculi. Which of the following investigations should be done next for this? See, this part. What is PTH? This is high. Okay, and there is presence of renal calculi. Okay, renal calculi. Okay. What is the normal level of PTH? Generally, normal level of PTH level 10 to 65 picogram per. Okay. Normal level of PTH. Normal level of PTH. Elevated PTH with renal calculi indicates primary hyperparathyroidism, typically from a parathyroid adenoma causing hypercalcemia. Okay, causing hypercalcemia. Localization of the overactive gland is essential before minimally invasive parathyroidectomy. Recommended imaging is technetium 99M Sesta MIBI scan is the first line nuclear imaging test for detecting parathyroid adenomas with high sensitivity of 80 to 95% for solitary lesions. It shows differential uptake and washout compared to thyroid tissues. Ultrasound, not thyroid specific here. DEXA is good for bone density. Follow if needed. Radioactive iodine is for thyroid condition. Come to the next question. Question number 29. Very easy question. Itchy lesions are present on the flexural sides. This is a flexural sides. Flexural sides of the arm of a 14-year-old high school girl. Asthma is present in her family's history. So, there is asthma positive in family history. Okay, it means might be possible either father, mother, any parents or siblings, brother or sister or brother. Okay, anyone have asthma in the family. Okay, most probable diagnosis is seborrheic dermatitis, atopic dermatitis, allergic contact dermatitis, Ripsellas. Okay, atopic dermatitis. Why? Because pruritic flexural lesions plus family history of asthma, that is atopic dermatitis, AD, atopic dermatitis. Okay, AD, atopic dermatitis. Scratch marks and excoriations due to chronic itching. This is all this lesion. This is because chronic itching, nothing else. Okay. AD is linked to IgE. AD is linked to IgE. This AD is linked to IgE mediated hypersensitivity. Come to the next question. Question number 30. Although hair dye is unhealthy, few people continue to use it to color their hair or dye their hair. Skin reactions to the usage of hair coloring. The most prevalent cause of allergic to permanent hair dyes, causative agent. What is the causative agent? Okay, causative agent. That is D. PPD. Okay, PPD. Oh, answer is written here, PPD. Okay, explanation, PPD in hair dyes, allergic contact dermatitis. Okay, come to this question. 31. A 68-year-old farmer with thigh claudication and iliac artery occlusion on the angiography, which is the best surgical procedure? Which is the best surgical procedure? Okay, which is the best surgical procedure? Aortofemoral bypass. Aortofemoral bypass. Why? We also say Leriche syndrome, the gold standard for Leriche syndrome. Where is Leriche syndrome, gold standard for aortofemoral bypass Dacron graft. See here, you cannot see here. Okay, it means this is aortobifemoral bypass, common iliac artery, femoral artery. Okay, main causes of proximal claudication and pseudoclaudication. Claudication and pseudoclaudication. Okay, so venous congestion. Here is the venous congestion. Here is the internal iliac stenosis, bone metastasis, hip osteoarthritis. Okay, common iliac artery stenosis, lumbar artery stenosis, lumbar spinal stenosis. So, axillofemoral high risk patients. Axillofemoral high risk patients. So, this question 31 is answer is aortofemoral bypass. A 68-year-old farmer with a thigh claudication and iliac artery occlusion. So, most commonly common iliac artery or iliac artery here occlusion in this question. So, option is C. Okay, option is C. Thank you very much, my dear friends. Thank you very much. We have finished our class. If you like it, support me, support my channel, and subscribe it, share it to your friends. I'm sure you will get benefit. I'm trying to do hard work to share my knowledge, whatever I have. I wish to share my knowledge to you people. If you people like it, get any advantage, please give your comments so that I will try my best to improve it day by day. Hope you will get it. We'll continue our lecture. Again, I will make another video and share it to YouTube channel. Okay, thank you very much. Have a nice day.